Hi, Dr. Herman here, and I want to share with you another very interesting finding about another patient who came into my practice yesterday here in South Florida, a 66-year-old female she described it's fibromyalgia. She has had for a year, a little bit longer than a year maybe, she's had pain, excruciating pain, stabbing, burning, just incredible pain as she described it, crying here in the chair in front of me. Pain from head to toe, and she said literally it's every inch of her body. In addition to that, she has osteopenia, she has loss of bone density, she has insomnia ever since she was a kid, 66 years old, and she's had insomnia ever since she was a kid. She takes medication for that for decades already. She has stabbing pain in her stomach. She's had acid reflux. She's got chronic fatigue for years now, as she described it. It's worse now than ever before after a passing of somebody in her family. She did have a hysterectomy. She's been anxious and depressed ever since she is or was a child. In junior high school, 66, in junior high school, she was on medications like a Prozac medication, like a Ritalin. She had been taking, right up until we met each other, Lyrica, Morphine, Percocet, Gabapentin. She'd been on Abilify, Ambien, Paxil, Prozac. She wants off of these meds. She wants her life back. Her significant other who came in with her wants her life back. And it's just, it's for her, as what she described, it's complete misery every day. She even, which later on, when she improves and allows me to share a video, if she will, hopefully she will, so you could see the difference from before and after with this kind of unique, awesome work that I've helped people with, that she has a very difficult time speaking. She said her teeth hurt. Her teeth are hurting terribly day and night, all of her teeth. She has a tongue in her mouth that she, quoting her, "My tongue feels too big." She is slurring as she speaks. It's almost as if she is drunk, or even almost like having a partial stroke, which is not part of her diagnosis. But she said for the past year, it's just the speech has become just getting worse and worse and worse. When I did my examination on her, I was looking for different tissues that could be, that are connected to her pains and her discomfort in her body. And what was very interesting for her when she first lied down on the table, and I'm going to tell all of you out there who are watching these videos who I get to consult with on a regular basis, I do get phone calls every day, I get emails every day from the social network sharing that I do. And what's very interesting for her was she had a stress that was like a black cloud over her whole head, if you will. That the cell phone electromagnetic radiation stress was the primary stress that we had to make actual remedy for that and pull that out of her body. Her body's vitality was so weak that we couldn't use all of the potency of the remedy to pull out all of that cell phone stress that is really hovering over everything, that is messing with every cell and tissue in her body. We had to make a very delicate one, a very light potency remedy, and gave her another stronger one that she had to wait 2 more days to take. That was Thursday yesterday. Saturday is her next day with that much stronger cell phone remediation remedy, until those are provided. And some people ask me, but I've tried this before, I've tried that before, that didn't work, I've tried homeopathy, I've tried acupuncture, I've tried chiropractic, I've tried herbal formulas, I've tried medications, and things just aren't working. People tell me that they can do for me different response testing. And what we've got to understand, what you've got to understand, is that if you have electromagnetic stress hovering over everything, every Lyme infection, every mold, every fungus, every parasite, every virus, Epstein-Barr, even residues of medications and drugs that you've taken, drugs, pharmaceutical or street drugs, non-legal drugs, that the electromagnetic stress really turns out to be the predominant factor that we have to clear from all of your tissues, because you don't clear that electromagnetic stress in the tissues, you will never see the end of your disease. And I'm going to make this very clear for you right now before I get into her findings. You've got to understand something. that even if you shut your cell phone off at night and you take out the battery and you turn off your circuit breaker box and you are sleeping with some kind of protective gear around the bed, or you've done things in the house, you can have an electromagnetic imprint from many different types of electromagnetic stresses, from the earth, from the cell phone, from the computer, from the TV, from the car, from the electricity coming out of the walls, from all of the Wi-Fi in your town, to even driving down the street and all the power cords that are out there, and the stoplights and the power and the passes like on the turnpike or whichever toll paying where you don't have to pay, you just zoom right through that thing. You get scanned constantly with electromagnetic fields. And you, even when you turn off your cell phone or you get a little protector for your body, your tissues have been imprinted. It's like getting a tattoo. If I went to you with a needle for a tattoo and I zap, and you say, no, I don't want the tattoo anymore, cut it out, forget it, that's enough, I can't do it. And you just had that one little dot of ink that went into your finger. That one little dot of ink is going to stay there until forever, until you die. And that one little dot of ink, you either will leave it there, or even if you don't finish the whole tattoo process, or you've got to be able to take it out using a certain technology. And that's what we have to look at when we're seeing your tissues. You want to go after your mold, you want to go after your Lyme, you want to go after your pain, you want to go after what you want to go after. We've got to look at what the body wants. And usually EMF, I should say probably 99.999999% of the time, electromagnetic fields are causing DNA, cellular, bone, brain, nervous system, organ, tissue, thyroid, everything stress in the body. All right, now we got that clear. So the cell phone stress for this woman with this terrible fibromyalgia, teeth pain, full body, head to toe pain, chronic fatigue, insomnia, depression, anxiety, all of her symptoms, all of her constipation, everything. Cell phones came up first. And then when we looked at her tissues to see which organ, which system was the primary system that needs to be helped, that needs to be relieved of its stress, that first tissue was not her brain. It was not her spinal cord. It was not her intestines. It was not her leaky gut. It was not parts of her brain. It was not her bone marrow in this case, even though you've heard me report about bone marrow on several videos here and different posts that I share online. It was not her kidney. It was not the nerve. It turned out to be a tissue that's in all of our systems that you probably have never heard of before. It's called the mesenchyme. I'll try to put that word on the screen so you could read it. The mesenchyme is like the primitive glue. It keeps all of your cells together. It wouldn't have a whole body that's put together, that stays together. The mesenchyme is the glue that keeps all the cells together. It even allows the cells to transport nutrients and information back and forth. And in her mesenchyme, which was her primary, not everybody's primary, but in some cases it is, electromagnetic stresses from Earth's geopathic stress showed up, dental EMF. She's got metal in her mouth, more than one filling, and that is another stressor to that mesenchyme. Television, LCD flat screens, plasma screens are throwing off radiation, and they are worse than the older screens, even though the technology is cool. The TVs are very light. The flat screens that we have on our computers are wonderful, but they're throwing off a certain kind of radiation, and that penetrated her mesenchyme and will not let those cells communicate the way that they need to. She has other kinds of electromagnetic stress coming out of the walls in the home. Now, after we found out and cleared those electromagnetic stresses, or set up remedies to help her clear those at home in her protocol, Lyme, Borrelia, Burgdorferi, that bacteria, that spirochete came up next. That came up as a priority. And in that tissue as well, in the mesenchyme, Candida showed up, one form, and I've got about 6 different forms of Candida here that I can test your body with. Bartonella henselae, another co-infection that is found commonly with Lyme, with Borrelia, that showed up in her mesenchyme. And a multiple mixture of multiples of mycoplasma bacteria showed up in her mesenchyme. She's tried to take multiple supplements. She has taken multiple supplements and medications. They are not alleviating any of her pain. They're not alleviating any of her symptoms at all. A friend of hers, or I should say who she gets her supplements from, who is another patient of mine who's already getting positive results, referred her into this clinic. And now this patient fully understands that until she can clear out that mesenchyme, until she can get rid of the EMF stress, nothing is going to work. That's why her supplements have not worked. Now, another tissue that showed up on her, part of the fatigue issue for you can be, it's not all adrenal, her kidneys. Her kidneys showed electromagnetic field stresses from the teeth in the kidney, and her lymphatic system needs some remedies that are going to be a daily process for her to allow her to keep on flushing out that lymphatic system. People want to jump up and down on trampolines, and they think lymphatic massage and drinking juices are the answer for the lymphatic system. And while those are all wonderful, I find in patients that they're not clearing out the junk from the lymph. The lymph sometimes really needs help. So, one more time, in order for her to start ridding her symptoms, we have to start at what the primary tissue is that needs help. We don't dictate to the body what it wants. You're conscious. What you want doesn't dictate to your body what it wants. Your body has a significant intelligence that's above what you can consciously think, than what your forethought is thinking, even though what you want. We know what the body wants, and there's a certain reflex type of test to find out what the primary tissue is. And for her, that's what it is. I'll be updating you in coming videos about what we're doing for her and her progress. She's on a 2-week protocol, and then I see her again. There are remedies that she's taken home, and those remedies will be taken on an exact protocol that I've written down for her and that she gets to take home. Okay? Thank you for letting me come into your home. Please click over on my YouTube page here at Dr. Herman Reports and click on the subscribe button, because I put up videos just about every day, sometimes even twice a day. I'm putting videos up here for people to learn that there is a way to help you reverse your chronic disease and get well. Share this video with a friend, just one friend. If you could just share it with one person. Okay? Thank you very much, and I look forward to helping you and your family and your friends get well.